was a Friday afternoon experiment to test a crazy hypothesis, and then when the first experiments came in, then we started believing that this could potentially be a novel asthma treatment.
Where there are 270,000 people living in the UK with uncontrolled asthma. And I think for every single one of those, just even the thought of this potential drug would be absolutely life-changing.
I think that it's a very exciting potential development because it hits an entirely new target, unlike most of the drugs that are currently used for treatment of asthma.
If you suffer from asthma, it's like being stalked by a killer. You never know when it's going to strike. 1 minute you can be normal, the next minute it's a bit like having somebody creep up behind you with a plastic bag and put it over your head.
The fact is, in the UK, 3 people die every day of asthma, and that's a terrifying statistic.
They take every drug we've got, and they often turn up at the local A&E department when they need to be in a place of safety. That's what they do. They don't have a life, they have a disease.
We're really excited about this discovery. For the first time, we have been able to show that there is a link between airway inflammation and airway twitchiness during asthma. What we've also discovered in preclinical models of asthma and in cells from human patients, that there is a drug which can stop this from happening and therefore potentially a novel cure for asthma.
This new approach to treatment does address the fundamental abnormality of asthma, which is increased twitchiness of the airways, because it reduces the calcium levels in the cells, makes them less twitchy, and that is the root cause of asthma. Even if we don't completely understand what causes it, we now have a firm target to look at, which has never been addressed before, and that's what excites me about this new approach.
This is innovative in the sense that we're actually repurposing a drug which was originally designed for a completely different condition. And we're purposing it towards respiratory disease and the lungs through a receptor which, until we'd looked for it, we didn't know was actually in the lungs or was involved in the disease process itself.
I think if the true potential of this drug were fulfilled, there'd be substantial savings, not only to the raw NHS costs of looking after the patients and paying for their medicines, but also the societal costs of people being off work, off school, on benefits because they're disabled with their asthma.
The next stage is finishing some of the key preclinical studies, but the majority of the funding we'll need in future, of course, is taking this to the point where it can be translated to man.
We want to stop asthma attacks and cure asthma, and that's only possible with significant investment in research. It's been underfunded for far too long, and we need to see these breakthroughs become a reality.
Investors have the opportunity to join an initiative which could potentially lead to a life-changing treatment for millions of people worldwide.
We're in the 21st century now. Why shouldn't it be a dream that we completely abolish patients' symptoms, free them from the fear of death, with a treatment that causes them no problems at all?
I think the key difference to my life would be that I would wake up in the morning, I wouldn't have that concern, am I going to be fighting for my life in hospital in an intensive care unit? Will I won't have any of those concerns, I'll just be able to live my life as a normal 24-year-old.